Welcome back to Healthy Living. So, in keeping with our theme, orthopedics, we're going to talk with Mike McNeil. He is our director of Outpatient Rehab Services.
Correct.
So, yeah, thank you so much for joining us, Mike.
Yeah, good morning. Thanks for having me. Appreciate it.
Appreciate
Glad
you
to be
coming.
here.
So, tell our viewers a little bit about you.
So I am a physical therapist and athletic trainer. So I went to University of Southern Mississippi and graduated in sports medicine. From there, I went to the LSU Medical Center in New Orleans and got my degree in physical therapy. And so I've been practicing since 1997.
Oh, wow. And how long have you been with the health system?
I've been with St. Tammany for 7 years.
Okay, great. So we talked a lot about the expansion of the Bone and Joint Clinic. We're very excited about that because within that space is this beautiful physical therapy space. It's beautiful. So tell people, if they're watching, as the viewer, if you come in as a patient, what does that mean for you now?
Right. So first of all, from an outpatient rehab perspective, we're super excited to be a part of this expansion of the Bone and Joint Clinic. As you mentioned, it's a very beautiful clinic. It's about 2,100 square feet with a lot of special equipment, and it gives us a great opportunity to really focus care on orthopedic patients. So if you're a patient, you have orthopedic issues, this clinic really allows you to have a one-stop shop, so to speak, in the sense that you have the physicians there that can initially evaluate you, and then from there you can have your physical therapy all in the same location. And this is beneficial because a lot of times issues are going to arise as part of your medical care. And the therapists that are there, Cameron Baddinger is our physical therapist, and Carrie Porty is our PTA. They are able to communicate on a daily basis with the physicians and the providers for any issues that arise. So they have that face-to-face interaction with the docs, which really eliminates any delay in your rehab, in your recovery, because any issues that pop up can be addressed right away.
Right.
The physicians can walk right back to the gym and see how you're doing with PT, evaluate any issues that may have popped up. And so really it prevents and eliminates delays in your care. You don't have to wait to hear back from your provider on what the next step should be. So it really allows for a seamless plan of care, great communication between the PTs and the physicians because everything is just kind of in-house.
Yeah. And do you think that in-house factor also kind of lends itself to, I know that when my family members have had injuries and it's like you have to go to physical therapy, but it's at a different location, some people drop off, and maybe don't even go.
Correct. So I think if you know that your doctor has advised you or recommended you do physical therapy, and he's also saying, hey, I have this great brand new clinic that I'd like you to do the therapy in, you're going to be probably a little bit more coerced or motivated to make sure you attend those appointments because again, that's part of the communication. If somebody's not being compliant with treatment, they can communicate that right there with the doc and let them know. So yeah, I think patients might be a little more motivated, and certainly, if it's convenient for them to see the physician in that location, not always, but most of the time it would be convenient for them to do therapy there as well. So again, it's just kind of trying to streamline everything and make it convenient. When you finish seeing the doctor, you can literally just walk down the hall and schedule your physical therapy. You don't have to make a phone call or anything like that. You can just do it right there, all in one office.
Yeah. So another real gem, I think, as part of this expansion and as part of your physical therapy space is this new leading edge piece of equipment. I have to look at the name of it, the Ultra-G anti-gravity treadmill. So tell people what that is because it's amazing.
Yeah, so like I said, we have a lot of specialty therapies that we offer there, but the Ultra-G is really unique. So the Ultra-G treadmill, it actually it's based off of technology from NASA.
Oh, wow.
So it's pretty high level technology. And what it allows us to do is put patients on a treadmill that cannot put all their weight on their injured leg. Okay? So if you're recovering from a surgery or you're recovering from a fracture and you're still within those healing restrictions where you can't bear full weight on your leg, we can put you on this treadmill and based on your body weight, we can literally take off in 1% increments weight off of your body, okay? So say if you're 50% weight bearing, you weigh 200 pounds, we can dial it into where you're only putting 100 pounds through your leg,
Okay.
to avoid, causing any damage to the healing process. And so that allows you to accelerate the rehab process. It allows you to start working on restoring your strength, restoring your balance, your range of motion, leads to quicker recovery and your function. All because we can do this earlier in the process. So we can get you on there walking,
Right.
Much earlier. Obviously, as you progress, we can start having you run on the treadmill. Even and it doesn't even necessarily have to be a surgery or a fracture. You could be dealing with a chronic knee pain issue, maybe an arthritic knee or something, and we can take weight off of that knee that allows you to run and not have any pain. So it's a very, very specific dosing piece of equipment that allows us to really hone in on getting you right at the right exact amount. Because, honestly, without this technology, if a doctor says, okay, you can put 50% weight on your leg, well, what is 50%?
What does that mean?
How do I
Right.
know I'm putting 50%?
Right.
You're just kind of guessing. This allows us to scientifically dial it in and make sure that we're staying in a safe range and progress the patient much faster in the process.
So we do have, you are Director of Outpatient Rehab Services. So what does that mean? We have lots of outpatient rehab services that are available, or a smattering of selection. So where can people go besides the Bone and Joint Clinic if they need therapy and rehab?
So like we talked about, obviously bone and joint, if you have orthopedic needs, that's definitely one place you can go. We also have the YMCA. We have a clinic in there, which is also primarily for orthopedic patients. And that's been a great location for us, especially for people that go to the gym already.
Sure.
And they get issues. It's very convenient for them. Again, it's all about convenience for the patient. So we have that location. We also have our primary location, which is on North Azalea, corner of North Azalea and Highway 21. It's actually across the street from the Bone and Joint Clinic. And there we see a smattering of everything. We see adults, we see pediatrics, we see neurological patients, we see orthopedic patients, we see occupational therapy, speech therapy, physical therapy. So we see pretty much that's our home base.
And cardio and pulmonary too, correct? Or is that there?
That's done at the outpatient pavilion.
Okay.
But we do have that, but it's at the outpatient pavilion. So we have the North Azalea location. We also have a clinic in Folsom, which also does adults and pediatrics, PT, OT, and speech. And that's where we also offer our hippotherapy, which is another unique specialty that we offer. We just recently opened the GME clinic, and we're going to have a small PT presence in that office as well.
Okay.
So that just opened this week. And then we also offer pelvic floor therapy at the Women's Pavilion.
All right.
That's the only location where that is offered. And then finally, St. Tammany also provides the therapy services in the Cancer Center for those patients that are dealing with various issues related to their cancer treatments.
Gotcha. So we have a full range of therapy options for all of your needs. So we're going to give you the phone number to the Bone and Joint Clinic for sure to schedule an appointment with PT. You would call 985-773-1494. If you would like to learn more about our other locations, go to sttammany.health. Is there anything else you want to add, Mike?
I would just say that, you can, obviously the most common way we get patients is through a referral from your provider. Doesn't have to be necessarily an orthopedist. It could be your primary care, it could be a family medicine, it could be a physiatrist, obviously orthopedist. So we get a lot of referrals from doctors, so that's one way to come see us.
Okay.
But also from a physical therapy perspective, we take patients without a referral, what's called direct access. Our Practice Act allows us to see patients up to 30 days without a referral.
Okay.
Of course, this is insurance dependent, so your insurance has to allow you to be able to go to a PT without a referral. But I did want to mention that you can definitely come see us through a traditional route of a referral or through direct access.
Perfect. Well, physical therapy has come a long way throughout the years, for sure.
Yes.
This anti-gravity business is pretty cool.
Sure, the anti-gravity is awesome. And then we hope to later this year incorporate the diagnostic ultrasound as another service at the bone and joint.
Wow.
We want to be able to offer that to the physicians on a consistent basis, so we're working towards that, to where if their patient needs to get an ultrasound on a shoulder or a knee or whatever the case may be, that we can be there to offer those services in that office. Again, just trying to streamline everything for orthopedics into that office.
Oh, great. Well, thank you so much for coming and sharing with us this great information. We're looking forward to sharing it with everyone else.
Thank you.
And we will see you next time when you come in, because I'm sure you'll be back. And I want to thank everyone here for watching us on Healthy Living today. We'll see you next time.